we've come a long way. Even in my, when I was a resident, egg freezing was still experimental, and now we're able to do it, with pretty good technology. So I think if you think that having a family is important to you at any age, talk with a fertility specialist so you can sort of understand if you have any underlying problems that might make it more, difficult to have a family when you want a family. But then also there's always, a possibility of freezing eggs if that's something that you desire.
Are you a busy woman who prioritizes everyone else's health above your own? Do you have questions about your diet, exercise, or how to prevent or treat certain health conditions? Are you always Googling health questions that you forget to ask or are embarrassed to ask your primary care physician? Girl, do you even have a primary care physician? Well, welcome to Headed to Healthier. I'm Dr. Brittany Anderson, a board-certified family medicine physician, and every day in my private practice, I have discussions with women just like you who are doing their best to juggle the demands of life while also desiring to become healthier. Inside this podcast, you'll find practical and actionable health tips that you can incorporate into your daily life. You'll get expert advice and insight from some of my awesome healthcare colleagues, and you'll hear relatable conversations with incredible women just like you who have made their health a priority and are thriving because of it. So throw on your sneakers and get some steps in while you listen. Or if you're driving, get those hands at 10 and 2 and let's dig in. We are headed to healthier. Hey ladies, welcome back to today's episode. I'm so excited to be joined by Dr. Erica Bove today. Dr. Bove is an obstetrician, gynecologist, and does the important work of doing some reproductive, endocrine, and infertility work. So she's what we call an REI specialist. I think that all physicians, are out doing great work, but you REI specialists are doing God's work. It is such a privilege to have you here on the show to share with us. Dr. Bove, introduce yourself to us a little bit.
Oh, thanks, Dr. Anderson. So I am, right, like you said, I'm an OB-GYN and a fertility specialist. I'm also a fertility coach, which has been sort of a new evolution as of the last few years. I am really passionate about helping people build their families, obviously not getting pregnant when they don't want to get pregnant, but then also when they do, helping people get pregnant as efficiently as possible, but not just even like in a mechanical way, but like saying this journey should not take everything from you. And so how
Right.
can we make this just like a room in your house, just part of the process, just like we would do anything. But I
Yeah.
think, your audience being high achieving women over the age of 40, really taking control of their health while they're busy, it can be really hard to do that, as a 40-plus-year-old, because first of all, we're not taught a lot about our own fertility in general.
Right.
And I
Right.
think, depending on where you live, many people have to drive a ways to even access these services. So I would love to have a conversation today about how to make things more accessible and just maybe kind of decrease the uncertainty around what's all involved in even talking with a fertility specialist.
Absolutely. Well, let's do that because you just hit on some of the really big questions that I know are out there. They're questions that I've had myself. I know friends around my age have had, especially, some of my female physician friends as well. So it certainly is something, the concern about fertility or the questions around fertility are questions that many women have. So again, so excited to have you here today, to be a friendly OB-GYN and REI specialist to talk with us today. So let's just start with the basics, Dr. Bove, if that's okay. Can you talk a little bit about what actually happens to fertility in women as we move, into our late 30s and early 40s and even mid 40s?
Absolutely. So, unlike men who are making sperm throughout their whole lives, really, from puberty through their older age, we have a shorter biological timeline. So, from the time that we start having periods when we're teenagers till about, the age of menopause, which the average age of menopause in the US is 51, our bodies undergo a series of changes. And so, I think we've all heard that magic number, like 35 is like when everything goes downhill. And I do want to challenge that a little bit because, we have genetics, we have environmental factors, like there's no two people with the same fertility story, right? And so
Right.
what we do know though is that we're probably at our peak fertility in our 20s and early 30s. And then at some point in the mid to late 30s, and I say that in air quotes, our egg number is declining, our egg quality is getting worse. Truly, the eggs are getting tired and they have a harder time shuttling the chromosomes where they need to go. And so, how we see this clinically is that it can take longer to get pregnant. And even when people do get pregnant, starting in their mid to late 30s for most women, although, like I said, it's a bell shaped curve, that we often see an increased risk of miscarriage, which can just be so devastating.
Right, absolutely. And many women in their late 30s and 40s are often told that it's too late, right? It's too late to even think about conceiving, thinking about pregnancy, thinking about having children. From your perspective as a fertility specialist, this is what you do, this is what your jam, this is what is your jam. How true is
Yeah.
that? And what do you tell women when they come to see you and they say, well, Dr. Bove, I've been told so many times that this is not possible at my age. What do you tell those women?
I mean, if I had a nickel for every single time someone had
Yeah.
come to me telling me that they were infertile and then, we were able to bridge them to parenthood, I mean, that would be like my life would be a
Be
different
full
story.
of
Like,
nickels. There you
I
go.
think we can't always believe what we're told, and I think sometimes people are well-meaning, but they may not have accurate diagnoses. They may not really understand the full story, and so what I tell people is that fertility is not a light switch. Like the lights don't just like go out at the age of 35. What
Right.
happens is that we become less and less efficient over time, and even I just recorded a podcast. I'm a fertility specialist with no test for infertility because we don't have any tests. We have
Right.
numbers that can say, okay, I can check a hormone level called the anti-Mullerian hormone, and that can tell me, if you're on the good side of the numbers for your age in terms of egg number, but that has nothing to do with quality. The best test that we have for quality is not even a test, it's age, the age of the woman. And so, I will tell it to you straight, as I always do. If somebody comes to my office and they're already 40 years old, I do have a pretty frank conversation with them. And I say, pregnancy rates for women at the age of 40 with regular sperm exposure are about 5% per month. When we're
Mhm.
at our peak fertility, it's only about 20% per month. So we are inefficient as humans. But
Right.
when we're 40, pregnancy rates per month are about 5% with a 25% risk of miscarriage. And so I always, am very cautious. I say, I really hope I can help you. If your own eggs are not panning out, there are other options for building your family. And I firmly believe, I've been doing this a long time. I firmly believe that people who have the desire in their hearts to become parents, there is a way. And
Right.
so, the strong plan A is usually a person's own eggs. And if they have a male partner, their male partner's, sperm, that's usually a strong plan A. Although once we get into diagnosis, once we get into even treatment, sometimes we look at the big picture and we make adjustments based on the person's values, their identity, and what treatment options they might consider. So I will say, I really refute that. I think that we need to keep an open mind. We need to look at the facts. We need to look at the history and see, what we can do, what we can offer people to help them try to build their families.
So I think you get to this really good point that is that women shouldn't stop at that comment, right? So you shouldn't stop at that comment from, friends and family who are telling you that. You shouldn't stop at that comment from your primary care doc. You shouldn't even stop at that comment from your primary OB-GYN, right? That this is what you do. Will you talk a little bit about the difference? So you were trained as an obstetrician gynecologist, but tell us a little bit about the difference in that and the REI work that you do specifically.
Yeah, so if people who are listening don't know the pathway, which many people don't, so what I did was I did 4 years of medical school, well, 4 years of college first, then 4 years of medical school, and then 4 years of an obstetrics and gynecology residency program. And then I decided, I could have hung my shingle at that point, but I decided to do a little more subspecialty training. So that's 3 additional years beyond the residency is considered a fellowship, and so that's where we learn how to do egg retrievals and embryo transfers and really diagnose complex reproductive disorders and how to treat them. And also, it also extends to like menopause work and abnormal puberty. It's really the whole spectrum of reproductive endocrinology, which is any sort of hormones that are reproductive in nature that kind of affect the system. So that is the pathway. To add on to the previous question that you asked me about sort of what happens, I think that the 40 to 43-year-old sort of time window is its own window. Again, not the same for every single person, but I think that, 40 is not the same as 41, which is not the same as
Right.
42, to the point where many clinics in the US actually have the 43rd birthday as the cutoff, where they would not offer in vitro fertilization because it's an invasive procedure because the success rates start to become very low. And you could argue, okay, well, you need open fallopian tubes to get pregnant outside of IVF. You need functional sperm. If people don't have that, what options are there? There are some clinics that do go to the 45th birthday as well. But in my own experience, I've had only a handful of pregnancies between
Mhm.
44 and 45 and this is like, tens of thousands of patients. And
Right.
and usually if somebody's going to get pregnant, it's going to be outside of IVF. And so that's sort of, if you're listening to this and you're like, "Oh geez, I'm 41. I wonder if it's too late." No, that is a great time to get yourself right into the office of a reproductive endocrinologist. Maybe you're 40 and getting married. Everyone meets their partner at a different time, and some
Right.
people don't even meet a partner. They still want to build a family. And so get an appointment with an REI. A lot of us do telehealth appointments. And so that's one way to kind of just start the conversation and start the testing. Like I said, 44, 45 with a person's own eggs, it gets, less likely to happen. But there are options for what we call third party reproduction, where many women are, learning about egg donation. And so choosing an egg from an egg donor, just like we've done sperm donation for 40 plus years, that we can actually have, a woman who would donate her egg. So the process, it is fairly expensive, but I've seen many women in their mid 40s, late 40s successfully have babies this way. And it, from my perspective, it really helps people build a beautiful family if that's something that people would be open to.
Absolutely. So if you're in that 40 to 43 range, this is prime time to get moving if that's your plan. And
Yeah.
there's this thought and you were starting to hit on it and you absolutely did hit it that you don't have to be at the point right now to say I want to build a family right now. But if you I think you said if just met a partner or you're about to get married and you're thinking, yes, I want to have a child with this person. I don't necessarily want to have it, in 40 weeks from now. But maybe down the road, this is the time, right? The time to go
Mhm.
ahead and get plugged in and maybe be able to preserve those eggs for later use, right?
Absolutely. Yeah. I always say if you don't think you're going to have biological children by 35, it's a great time to get something on ice. I've gotten more conservative in my counseling. I used to say this is an insurance policy. I've done enough cycles now where I've seen some women return to use their eggs and it doesn't go as planned. And so, I always say if this is a priority for you, think about it for the future. And I do have a lot of people take me up on it because it is a way to say, okay, well, it does take some of the pressure off, or maybe somebody has their first kid at 37 with their partner and then they have a hard time, with baby number 2, they can go to the freezer and try to use their frozen eggs from younger, sort of more high quality eggs. So we've come a long way. Even in my, when I was a resident, egg freezing was still experimental, and now we're able to do it, with pretty good technology. So I think if you think that having a family is important to you at any age, talk with a fertility specialist so you can sort of understand if you have any underlying problems that might make it more, difficult to have a family when you want a family. But then also there's always, a possibility of freezing eggs if that's something that you desire.
There you go. Get those things on ice. I love how you said that. I love
Liquid
that.
nitrogen to be specific.
There you go. There you go. I love it. I love it. Dr. Bove, what are some early signs? So say, we have a woman who's listening to you and I chat now, and they are thinking that maybe they've been trying to conceive for a period of time and have not been successful, and they are worried that their fertility might be declining. At what point do you say, okay, this is something that you need to talk with your doc about, talk with a physician about? What does that line look like for you?
Absolutely. So, this is what the American Society of Reproductive Medicine recommends. So it's not just my own opinion. If you are under the age of 35 and you've been trying for a year without success, then go see a fertility specialist. If you are 35 and above and you've been trying for 6 months, at least 6 months, and it's not working, then please do go and see a fertility specialist. Now, there are some caveats. Say you have, risk factors for what we call fallopian tube disease, which means, the fallopian tubes, I always say they're the highways for the sperm on the way up, and they're the highways for the embryos on the way down. And so, if you think about it, you really do need open and functional tubes for this whole process to work. So say you're somebody who's had a lot of abdominal surgery and maybe some scar tissue in there. Say you've had pelvic inflammatory disease and you were, hospitalized, and due to that, there might be some concerns about, scarring, like there's situations where we do say, you don't prove it for a year, but like
Mhm.
maybe somebody who has risk factors really should get evaluated. Maybe not the full evaluation, maybe it's just a fallopian tube test, but just to say, I hate when people lose time. And so if you have a risk factor like that, please go see a specialist like sooner. Don't even wait, really. And then also, there's a lot of what's called polycystic ovarian syndrome,
Mhm.
PCOS, and it's really a misnomer. But what it is when is this constellation of when people maybe they have irregular cycles and they're not getting a fair chance at trying every month because they're not ovulating every month, or maybe they can have some like extra hair on their face or acne. Some people have ovaries that look a certain way on their ultrasounds, and sometimes it's a constellation of these things. If your cycles are irregular, do not wait. Do not wait, because that means that, with irregular cycles that you're not even getting a fair chance. Somebody who
Right.
has 3 periods a year might only get 3 chances a year. And that assumes that the sperm are normal. That assumes that
Right.
people are getting together with their partners when they don't even realize they're ovulating. And so I always say if you have irregular periods, it's another reason not to follow those ASRM guidelines, but to go in sooner. I mean, ASRM would agree with me, to be fair, but like we don't want people to lose time. We have to also use our common sense.
Right. Time is so important. I love that you added that on. For women who are, late 30s, early 40s, who are trying to conceive, what are some things from your clinical experience that are factors that make a big difference in success rate? So whether those are medical factors or lifestyle factors, is there anything that you tell women when they are working through this fertility journey about changes that they could make to perhaps make them more successful? And whether that's through the journey or if you're giving kind of that heads up advice for someone listening who is 25, 26, 27, what lifestyle or medical things do you
Sure.
talk to folks about?
Yeah, and so I think, to your question about the late 30s is a good one. I always say, if you think you might be in a position where you could welcome a child into this world, don't wait 5, 10 years. I saw somebody the other day who was in their mid 30s who said, I think I'm going to start to try at 44. And I'm like, okay, I understand that that's your desire, but we need to understand that this is an inefficient time. And so I do think that part of optimizing natural fertility, not to make anybody rush or do things that they feel uncomfortable with, but if somebody feels like they're in a stable position where they really want to do this, to prioritize that, because I think we are sort of fed the lie that we're fertile forever.
Yeah.
And it's just not true. And once we get into the mid to late 30s, like every 6 months does make a difference. And so just if it's a priority for you, ask yourself, am I trying now? And if I'm still contracepting, why am I contracepting if I think I want this to happen? Okay, I'll get off my soapbox. So you asked me about the medical factors. Certainly cigarette smoking is one of the worst things. And it's, I'm a coffee drinker myself and I love my 2 cups of coffee. So if you take away my coffee, I'm not a happy person. So I'm saying this with a lot of compassion if you are listening to this and you do happen to smoke cigarettes. Smoking cigarettes adds about 5 years to your age. So if you're a 37-year-old woman and you happen to smoke even a little bit every day, that it's essentially like you're 42 and trying, and those rates are extremely different. And we do see that when women quit smoking, their egg reserve numbers, get better,
Oh,
their
wow.
quality gets better, and so that's probably the number one thing. And I mean, I don't know about in Alabama, how many marijuana smokers do you have? Do you see a fair amount? I live in the land of the marijuana, which is why I
Yeah.
mentioned this.
Right. So we're not in the land of the marijuana legally. Legally, we're not in the
Okay,
land
okay,
of the
okay.
marijuana, but the land of marijuana is actually here also. You're
Yeah.
right.
I think people treat their anxiety with,
Exactly.
smoking
Yeah.
marijuana and sleeping and everything. So marijuana is also not in, THC, CBD,
Right.
like however you want to split it up, like none of that stuff is good for fertility. So it's a lot of it. I always say to patients, there's some things we can control. There's some things we can't control. We cannot control age, but we
Right.
can control the things we put in our bodies. So like the toxic chemicals, like especially a lot of men chew. Chewing is even worse than smoking, interestingly enough. So I know it's hard. I'm not trying to kill the joy, but these things really do affect eggs and sperm and chances. And so, ditch the smoking. If you have secondhand smoke exposure, get that out of your life. Look at marijuana exposure. Alcohol, people ask me about that. I mean, truly, alcohol doesn't seem to make as big of a difference as other substances. But clearly, like if you're drinking a lot
Moderate.
as a woman and you happen to get pregnant, like, you want to be able to be having a pregnancy diet kind of even before you're
Right.
pregnant.
Mhm.
Now a supplement that not a lot of people know about that's very powerful is called coenzyme Q10 or CoQ10. I think
Mhm.
it should be in the water for those of us above the age of
I agree.
35. I mean,
Mhm.
obviously, if we're trying to get pregnant, it's an antioxidant. It's, it's like having more blueberries in a day, but there's actually animal and human data that it makes an effect, it helps with that egg energy we talked about at the beginning.
Mhm.
Egg quality issues really stem from the eggs being tired. It restores energy to the eggs so that they can do their job. And so
I
the
never knew that. That's fascinating.
yeah, so the dose is 200 milligrams 3 times a day. There's different brands, no brand is better than
Right.
another. You get it at Costco, wherever you can buy it in bulk, and it's, like, less, less expensive, but, keep it in your purse because it's, like, 3 times a day. It's kind of annoying, 200 milligrams 3
Okay.
times a day. So coenzyme Q10 or CoQ10. DHEA people have talked about, but I will say I don't love that one because it doesn't seem to have make a big difference. And invariably, like 90% of my patients get back acne because it increases testosterone. And I don't know about you, Dr. Anderson, but I don't like giving
No,
acne to my patients.
neither do I. Good call.
Yeah, and then the last thing I would say about lifestyle is, well, yes, all the things like eating well and exercising and sleep and stress reduction, of course, but weight is one of those things where we do have data that carrying extra weight is just really hard on the process and probably
Mhm.
through a pathway of inflammation because we know that when you give women GLP-1s even before they lose weight, they are starting to get pregnant at much higher rates. And so
Right.
there does seem to be something pro-inflammatory about carrying extra weight. And so it's such a struggle. All the old fashioned stuff like Whole Foods. And I love your podcast. I actually learned so much from your podcast about
Oh,
protein.
thank you.
That podcast has changed my life actually. Cause
That's
but
fantastic.
just as a tangent that if you haven't listened to it, listen to it if you're listening, because I was so overwhelmed by protein and how
Mhm.
much and what kinds and how to get it. And I feel like I'm pretty educated about diet, but every time I think about protein, my brain would just shut down. Now that I've
Right.
listened to your podcast, I've been able to actually track my protein and have a goal and just sort of be a lot less overwhelmed. So thank you for that.
That's fantastic. Thank you.
But yeah, but the weight thing, if you are carrying a significant, amount of extra weight, and I know it's controversial because I'm a very body positive person, but if you look
Mhm.
at the data, it does seem that, people with a body mass index over 30 do tend to have more struggles, getting pregnant, staying pregnant, birth
Mhm.
defects, C-section rates, all the things. And so sometimes, talking with a doctor like you, Dr. Anderson, about options. And some people even do go on a short term of GLP-1 even to like
Mhm.
see how that goes. And I mean, this is a whole other podcast, but I will say the preliminary data about conceiving while on these medications, even though we don't have like a randomized controlled trial, the preliminary data actually do look pretty reassuring, even though I can't say like, oh, don't worry about it. Like, we have so many other medications that have really known harms. And if you look at it, the safety profile seems to be pretty comparable to like insulin or metformin or any of the other medications we use to treat diabetes. So I just wanted to mention that. So that's a really nice adjunct that we have now that we didn't used to have. And again, it's not one size fits all. I always look at people's pregnancy history and such, but those are the main things that can really help people to optimize their chances. And, to see a fertility doctor on the sooner side, have a good relationship with your REI. You know, all REIs are not the same. Every
Right.
relationship's not the same. So, really find somebody who you can trust and who you can hear good news from, hear bad news from, because I really do believe after doing this a long time that your relationship with your doctor really makes a difference, just like it does with any other health outcome. But I do see better outcomes when people can trust their doctor and trust the process.
Absolutely. And Dr. Bove, I've gotten the opportunity to kind of learn more about the work that you do and hear some of the great work that you're doing over the course of the last year. I wondered if we could kind of interject in the middle of what I planned because that was a perfect segue when you talk about the importance of making sure that you find an REI specialist that you can develop a good relationship with and one who cares about your outcome, who really cares about your outcome and is interested in taking that journey with you. So if we can pause here, I've got a couple more questions that I want to ask you for sure, but I thought that was just such a beautiful segue into you telling us a little bit about the work that you do and just how you help women and how listeners can find you if they have learned. I'm over here taking notes. I've learned so much from you already, but how others can find you just on your social
Yeah.
media and those things.
Yeah. So absolutely. So a few years ago, I was in my clinic feeling actually quite disheartened because I felt like I was doing my doctor job, right? Explaining the labs and explaining the studies and giving people their options. And, people on the other side of this conversation, I'm an empath, so I can really read body language. It was like deer in headlights. I'm like,
Yeah.
I was so frustrated. I'm like, I am doing my best to reach these people, but because of the anxiety, because of the uncertainty, because of the deep fear this isn't going to work, everything I'm saying, it's just not soaking in.
Yeah.
And so I really said to myself, okay, how can I do better? How can I help people truly absorb this information, start to make empowered choices? And, interestingly, at the same time, I was engaging in coaching for my own,
Mhm.
personal development, relationship coaching and parenting coaching. And, I started to think, huh, maybe I'll be a coach. Like I just got this, sometimes you get those intuitive little
Yeah. Yeah.
God just speaks to you and you're like, okay, all
Yeah.
right. So I decided to go to coaching school kind of on an intuitive, I just knew it was my next indicated step. I didn't know where I was going to lead. And when I
Mhm.
was in coaching school, I remember being like, huh, I actually think these are the tools that my patients need to
Yeah.
be able to get into their bodies, to tune into their own wisdom, because we all have our own wisdom, even if it's blocked. It's just we got to
Yeah.
access it, and how to make values-based empowered choices. And so that's when I decided, you know what? I'm going to form a coaching practice specifically for professional women who are trying to get pregnant that really addresses those concerns that we often don't have time to address in the context of a busy clinical day. And
Right.
so, I still work as a, fully functioning fertility specialist at the University of Vermont, but I also have this passion project, and actually quite a bit a busy coaching practice right now of women. We do one-on-one coaching. I have, homework and, course. We do group calls. We had a book club the other night that really kind of gets to the root of okay, what are my fears? What are my anxieties? How much mental space is this fertility process, taking up? I love this. If you know what, maybe we can even put this in the show notes. I have a podcast called Balancing Trust and Advocacy that a
Yeah.
lot of people have loved because just to what we were talking about before, you need to understand that your REI is in your corner. And unless
Mhm.
that's the case, maybe it's not a good fit and maybe a
Right.
different doctor is better. But sometimes we even have a doctor who's in our corner and we don't realize it. And so in that podcast, I talk about how to really lean in and tune into your own intuition of am I getting what I need in this relationship? Does
Right.
my doctor know my details? Am I getting tailored care? How does it feel during the context of these, relationships? Sometimes if you feel dismissed, if you feel like you're not
Mhm.
being heard, I think we all know when we're being heard, and I think
Yep.
we all know when we're not. And so really giving the people the tools to say, huh, how do I feel in the context of this relationship? Is this a good relationship? If it isn't, maybe there's some tools to bring it up and sort of try to navigate as we would in any relationship that's
Right.
maybe on the rocks. But if we really know that it's not serving us, then really thinking about getting a second opinion and
Mhm.
finding a person who's a good fit, because we all deserve as patients to have a doctor like you, Dr. Anderson, who listens to us, who gives us the best shot at a good outcome. And that's true in the fertility world, just as it is when we're talking about other health outcomes like menopause care, high blood pressure, high cholesterol,
Absolutely.
all the things that you help people with every day.
Absolutely. Tell us about your more a little bit more about your podcast and your social media, all those things that I'm
Yeah.
going to show notes.
Absolutely. So I am an introverted introvert, but I learned, early on, just
I
like you,
refuse
that
to believe that. You have such a
ah,
wonderful personality.
thank you.
Refuse to believe
Thank you. No, I really am though. And so I think I'd rather hide in a corner than be out in front of people. But the thing is
that.
that I believe so much in this mission that I believe that there are so many people who are just suffering in silence, who
Yes.
are walking into their fertility. It actually makes me tear up to think about how much suffering there is in the world right now in this way. And I realized, through my own mentorship, being mentored and coaching being coached myself, that the only way that I can help people is if I'm visible. And so, I have a podcast that's almost 2 years running called Love and Science Fertility. We talk about the science of it all. Actually, those are my most popular episodes, is how to grade an embryo and how to, why aren't my embryos taking, and all those different things that people just don't know, they want to know. So, but we also talk about the fertility journey is harder than I thought, and how to balance trust and advocacy, and some of the softer, more emotional parts of how to get through things, the holidays and triggers and all those things. And so
Right.
that's my podcast. I have a presence on Facebook, Instagram, LinkedIn. Facebook and Instagram are under Love and Science Fertility, to keep it simple. I'm always open to a DM. I love helping people. There's so many things that are so simple for me. If people bounce an idea off me, that just might seem so far outside of anybody's wheelhouse, just because this is my bread and butter. So I love helping people navigate their journeys, and I just love being out there, in our community, which is now global, to say we must do better as a society of helping people, number one, understand their fertility, Number two, helping them understand their options, and also obviously advocacy to make sure that every person's able to access the care that they deserve.
Absolutely. And it's so important is the part about understanding your options, right? So just really knowing what's there and what's available to you. And I think that that is one of the things that is key in finding a fertility specialist who, again, who you just jive with, right? Who you feel like you have a really good relationship with and who's in your corner. So, Dr. Bove, thank you so much for the strong work that you're doing. I wondered as we close if you would, if you'll oblige me one more question. And that question is for me to just kind of open it to you to ask what you would want to leave our audience with. So, if there's any encouragement or advice that you would give to a woman, like myself, who's 39, who just hadn't, quote unquote, pulled the trigger yet and decided to do this. And I know that there are many women listening who are the same, or women who are in their early 40s who are still thinking about, gosh, do I want to truly grow a family? How do I prioritize this with all of the other busy things that they're doing? I know this is, what you love. What closing advice would you leave for us?
Okay, so what's on my mind and my heart is to all the listeners out there to give yourself grace. I think it is impossible to be a woman in our society today. There's so many demands, especially if we choose a career pathway. It's nearly impossible to be a woman in our society today. And I think at some level, it's programmed into us that no matter how we do it, we're doing it wrong. And then that's just not true. It's just not true. And somebody told me once when I was in college, Erica, you can have everything you want in life. You just can't have it all at the same time. And
Mm,
I think that's really, really sage advice. And so if you're beating yourself up because, you haven't seen a specialist yet, or you haven't gotten pregnant yet, despite trying, truly give yourself grace. 1 in 6 couples has infertility. And, it's really kind of, I think, harrowing to think about that. And so now we are in the moment in 2025, right? We're listening to this podcast. The question is, where can we find our agency? Maybe it's picking up the phone and calling a fertility doctor for that consult. Maybe it's to sit and journal and just ask yourself, like, what do I truly want? Do I really think I want kids? Do I not? Am I not sure? Why don't I spend some time, where I'm like a, professional avoider sometimes when it comes to these big
yeah,
questions. So,
yeah.
what I need to make myself sit, pray, write, really try to get clear, talk with people with kids, talk with people without kids, really try to start to clarify that identity work, because I think unless we start there with our values and our identity, I think everything else can get very muddled and it can become about
Mhm.
what we think other people expect from
Right,
us. And
right.
so, some people want a family, some people don't want a family. Many, many people are unsure or ambivalent. That's all okay. But number one, give yourself grace and carve out the time and space in your life to sort these things out, because unlike men, our biological clock does have, an ending. And like I said, it's not a light switch, but the sooner that people see a doctor like me, the sooner we can intervene and make, having a family a reality.
Thank you. Dr. Bove, it has been such a treat to have you here today. Thanks for so eloquently sharing your heart with us and your passion for what you do. I appreciate you, ladies. I'm going to tag, her podcast, specifically that episode that she mentioned, and her social media in the show notes. So if you're driving as you're listening to this, or if you're out for a walk or a run, don't worry. You don't have to memorize anything she said. It'll be in the show notes, and you can come back and listen to this episode over and over again. Dr. Erica Bove, thank you so much for your time today. I wish you all the best in everything that you do.
Thank you, Dr. Anderson. Likewise.
Thank you.
Hey, thanks for listening in today. I hope something you heard in this episode will help you on your journey to becoming healthier. Remember, this podcast offers general health information. I am not your personal physician. If you need advice that is specific to you, be sure to consult your physician. If you enjoy this podcast, please consider sharing it with a friend and reviewing it on Apple Podcasts. Also, be sure to subscribe to the show so you never miss an episode. Tune in next week for another great episode of Headed to Healthier. Until then, take care of yourself. Talk soon. Bye.